So when we look at type 2, we do know that somebody can have type 2 for a long time before they're really diagnosed. And we're going to look at this like in a physiological model, because I think it comes clear of when should we really be starting some education. So we look at this first stage. You're going in, you're doing fasting blood sugars, right? Fasting blood sugars are perfectly normal. You take somebody who looks like they are probably high risk for development of type 2, overweight, inactive, maybe family history, and you draw insulin levels on that person. You will actually see an increase in insulin levels. Their fasting blood sugar is probably fine because they're having to produce so much insulin to keep those blood sugars normal. So as a provider, you test those fasting blood sugars, say, okay, no diabetes noted, okay, but you are at high risk, so kind of watch what you're doing. Well, I worked with a family practice provider that was amazing, and we did this research study with his patients. He identified 100 of his patients who he felt were at risk for development of type 2 through family history, through weight, through just their inactivity. And so he said, let's look at these folks. So we drew insulin levels on them, besides hemoglobin A1Cs and blood pressures and lipids and liver function tests. So we looked at these folks, insulin levels, the reference value of the lab that we used was under 13. So that's what we were shooting for. We had everything from 20 to 60 insulin levels. So what he said is that those pancreases are working so hard, within a year, how many of those 100 people will actually convert and go on to type 2? And I'll show you a model that we used with him to kind of prevent that. But that's that first stage. So we're drawing fasting blood sugars. Looks like good. But if you were to draw an insulin level, you would see that insulin level is very high.